So this is the second video of the UTI series, and this video we will be discussing prevalence and etiology of UTI. So talking about prevalence, we know that in first year of life, male gender is a risk factor, and almost twice as number of infants with male gender are affected in comparison to female. But after 1 year, the ratio, like it's kind of the male to female ratio in first year it is 2:1, but after 1 year it is around 1:10 in favor of female. So there are a large number of risk factor. If we trying to find the list, there are a number of lists, and so one factor is, as we say, it is age. So age is very important because, as we say, that this may be in first year, as we say, the male are more affected. So this kind of and gender is again important. So age, gender, circumcision is the reason actually that usually the male infants are involved more as compared to female infants. And circumcision has been implicated that this may lead to mucosal surface of the uncircumcised foreskin usually have some bacteria, uropathogenic bacteria, and there is also partial kind of obstruction. So these are the two theories that say that circumcision, uncircumcised children or infants have a higher risk of UTI. The other factors that are involved is female sex is involved because the urethra in female is shorter, and that's one of the reasons. Then there are certain anatomic abnormalities, for instance PUJ obstruction, posterior urethral wall, and obstruction of the bladder due to, say, neuropathic bladder secondary to MMC or spina bifida. Constipation is another important risk factor, and the way constipation leads to UTI is by mechanism of bladder ball dysfunction. Similarly, genetic factor are involved in increased risk of UTI. Some instrumentation like intermittent catheterization or catheterization may be a risk factor for UTI. Talking about, so this is just a summary of the risk factor here. Now, if we talk about the E. coli is responsible for almost 2/3. Some authority says for almost 60 to 80% of UTI caused by E. coli. That is followed by Klebsiella, Proteus, Enterococcus, Pseudomonas, and these are all gram-negative bacteria. Some of the gram-positive or Staphylococcus, Saprophyticus, Streptococcus, and aureus. Fungal infection has been also implicated, and there are some viruses that would cause UTI, and some Mrcpch has been also maybe one of the cause of the UTI. There are a large number of complications of UTI. We will definitely discuss it in one of the cases. But even in the first series we classified UTI, which is symptoms plus positive culture, to differentiate it from sterile bacteriuria or asymptomatic bacteriuria. And not sterile, asymptomatic bacteriuria will be just a positive culture, while UTI should be positive culture with symptoms. So pyelonephritis and cystitis are the two major classification, and in the next video we will be discussing about pyelonephritis.